Hi and welcome to Elevate Care Insights. This is Gradle speaking. If you're looking to cooperate and work with the hospital discharge team, you need to base your plan of action on the latest NHS England guidance, which is from January 2024 and can be found on the government website. The guidance for home care providers that we're going to suggest to you is to think about the key principles within that document. The NHS works to certain principles. They are on the government website. The principles are discharge to assess model, home first approach, person-centred care, multidisciplinary collaboration, and timely and safe discharge. So the discharge pathways that the NHS use are four. The pathway 0 is minimal support needed. Pathway 1 is new or additional support needed at home. Pathway 2 is short-term support in a bed-based setting. And pathway number 3 for patients at discharge are long-term nursing care in exceptional circumstances only. Home care providers will primarily be involved in pathways 0 and 1. That's pathway 0, minimal support needed, and pathway 1, new or additional support needed at home. So what would your roles and responsibilities be from the NHS guidance? For home care providers, there are 6 clear things. You need to engage with the hospital discharge teams early on in the process, conduct timely assessments of patients' needs, develop personalised care plans, arrange necessary equipment and support, provide ongoing care and reassessment, and communicate effectively with the healthcare professionals and the families. The discharge teams, the hospital discharge teams, will start the discharge planning on admission or before for planned procedures, provide clear information about the discharge process, involve patients and families in decision making, appoint a case manager for complex discharges, ensure medication and essential equipment are provided at discharge. So if you are a care provider, a domiciliary care home care agency, looking to start offering your services to hospital discharge, I would suggest that you have some best practices for your collaboration. The first thing is to establish strong relationships with the local NHS discharge teams and social services, which means hunting around for the contact details, seeing if they have got any open procurement or tenders going on that you can join, or any frameworks that you can join, and to often be in contact with them. Familiarise yourself with local discharge policies and procedures, and we've talked before about how you can get that information. Be prepared to start care packages quickly, often within hours of referral once you get them. Ensure your staff are trained on safely supporting patients transitioning home. Communicate clearly about your capacity and your capabilities. Participate in multidisciplinary discharge teams when appropriate. As always, really focus on assessment and care planning. Conduct thorough needs assessments promptly. Use your most experienced staff to do this. Develop personalised care plans that promote safety and independence. Regularly reassess patients' conditions and adjust care as needed, and escalate any concerns to the appropriate healthcare professional. Information sharing and documentation is key. Ensure you receive comprehensive discharge summaries, obtain detailed medication lists and administration schedules. Get information on follow-up appointments and referrals. Make sure they're diarised. If you use a care management system, make sure that they're in there. If it's noted, diarised, do that as well. Maintain clear records of care provided and any changes in your patient's condition. It's really important for you as a business to understand funding and payment. You need to understand that short-term care is usually up to 6 weeks and may be NHS funded. Be aware that longer-term care may require local authority assessment and funding, so you might be waiting for that. Some patients may need to self-fund their care. Ongoing support and review. Provide settle-in support when patients first arrive home. Offer choice and flexibility in care arrangements. Support patients to regain and maintain independence and regularly review the progress and adjust support as needed, but stay in contact with the people who referred the case to you. There's some key dates and updates that you should know about. That's the current NHS England guidance was issued in January 2024, is on the government website. Local authorities and NHS bodies should agree on discharge models that best meet local needs, so that means that they will have some local variations. Care transfer hubs are being implemented to manage discharges for people with complex needs, so you're going to need to know about those. And the next review of the national guidance is expected to be January 2025. So just to leave you with some additional recommendations and reminders, regularly review and update your company discharge processes. Stay informed about any future updates to the national or local guidance. Attend local meetings and training sessions on discharge processes. Consider implementing or participating in care transfer hubs. Ensure familiarity with the updated discharge to assess process.